Hello and welcome to week 10. We're almost there at the finish line. This is lecture 1. And this week we'll be going through a presentation, the Pierce County Community Health Improvement Plan, which is based off your reading for the week, your Pierce County Community Health Status Assessment. And while going through this plan, we'll be looking at what Tacoma Pierce County Health Department identified as key elements of their health needs assessment. So moving on, as you know, community health needs assessments are done with partners. So they partnered up with University of Washington Tacoma, Franciscan Health System, MultiCare, and they had other partners. These are just the core partners who helped them with the data collection. So in this presentation, we'll be reviewing the community health assessment results. We'll be maybe going over some of the activities they did when they met with the community to review this. So understanding the terms, just really quickly, Community Health Needs Assessment is a CHNA. Pierce County Community Health Status Assessment is CHSA. And Pierce County Community Health Improvement Plan is CHIP. So the Community Health Improvement Plan is a long-term collaborative and systematic effort to address health problems using the results of community health assessment activities and a community health improvement process, also called CHIP. So a plan that can be used by health and other governmental, education, and human services agencies in collaboration with community partners to set priorities and coordinate and target resources. So if you think about what we've been doing since week 1 is sort of leading up to making this kind of plan. So they have a whole process which is kind of interesting to look at. It's called MAP, Mobilizing Action Through Planning and Partnerships. So we see how important this partnerships piece is in community health. If we just go through this. So let's look at the individual pieces of MAP. So looking at Community Themes and Strengths Assessment, CTSA. So again, that's strengths assessment. We've been talking about needs assessment, which is looking at vulnerabilities, gaps in information, things like that. But what about looking at what a community is doing right and how we can amplify that or scale that up or recreate that model? Say they're doing their diabetes screening program really well. How do we scale that up to other screening programs and how to increase the effectiveness of what they're already doing right. So that's CTSA, Local Public Health System Assessment, Community Health Status Assessment, Forces of Change Assessment. And just to give you an idea of what these different assessments are looking at, FOC is what is occurring or might occur that will affect the local public health system or the community. So these are emerging issues. CTSA is what is important to our community and perceptions about the quality of life, about assets. CHSA, what does our health status look like at the moment? If we take a cross-section of this population right now, how does it look? How is the health of the community members? And then we have the LPHSA, and so the local public health system, what are its activities, what are its competencies, capacities, what is it doing, and what still needs to be done or improved? So these 4 kinds of assessments resulted in a master list, and so that's what this whole presentation is really about. So the process was pretty interesting. They went with a quantitative and a qualitative approach. The quantitative approach was more simple. They looked at pre-existing data sets, um, like BRFIS, which is the behavioral risk factor surveillance or something like that. So they looked at a pre-existing data set for quantitative data, and they looked at a lot of different questions for qualitative data. They looked at questions asked to the community itself. What makes a community healthy? What are the strengths, assets, and resources of Pierce County? Sort of a lot of broad questions. What are the challenges to health in Pierce County? And these are not things you can ask in a survey because they don't have a multiple choice or a 1-2 kind of answer. They're pretty broad and they're pretty subjective questions, but they're really important to identify needs. So other questions were they evaluated interviews with community leaders, public health advisors, board of health members as well. They connected with residents, including diverse underserved populations, plus leaders and community partners. They asked what trends and events related to social, political, economic, and technological issues. And they asked about gaps. So these were the meeting locations. Just pointing this out quickly because the star means meeting location, and they tried to spread it out. They tried to make this an equitable process in terms of where different community members were. They got Gig Harbor in there, northern Tacoma, they got Lakewood, Puyallup. They even went all the way out to Bonnie Lake. So the CHIP timeline. They worked on a specific timeline, which is important in a needs assessment, just establishing different activities such as workshops where they could interview people, multi-care and Franciscan. They did different reports on the hospitals, diverse focus groups. And a focus group, if you're unfamiliar, is a way of collecting qualitative data with a smaller group of people. It's often a more homogeneous group of people because you're trying to get an answer from a specific group of people. So they had 7 groups here, and then they had a community prioritization process, which is pretty interesting. And that was sort of later in the process, and then they had their co-action plan, which they developed after that. So drafting out the assessment results, they had a number of really important key findings. The first was mental health, 2 was substance abuse, third priority was health disparities, and the 4th was access to quality healthcare and services. So they developed this key findings through all the processes that we discussed in the previous slide, which would be the workshops, the focus groups, the quantitative data, the health establishment reports. So all these different kinds of data collection efforts led to this key findings. And so this is what they found. And as you'll notice in this slide, really interesting topics were brought up: poverty, transportation equity, homelessness, access to quality healthcare and services, social isolation through geographic isolation, educational attainment. So these were in that sort of equity and disparities process. In number 4, access to quality healthcare. So they looked at funding, reduction in social services, the need for health literacy and health education, healthcare provider shortage, workforce development, availability and access to prevention services, Healthcare Insurance Coverage, Affordable Care Act. And I appreciate that they got this in there, protecting and improving the environment, um, because that's not often discussed in community needs assessments for health. So, so that was a pertinent discussion that brought about a lot of great, uh, great information. So, so along with the process, one of their key findings was mental health. And within the larger umbrella of mental health, they understood youth depression to be a major problem. For girls, more girls reported than boys. This is just 10th graders, this chart right here. It looks like over 40% of girls were reporting youth depression. Adult depression, so this is from BRFIS, the Behavioral Risk Factor Surveillance System, and it looks like adult depression in terms of income was really high, more than 30%, probably about 1/3 of adults with a lower income bracket than 25,000 a year. And so what they heard in their discussions about mental health was a lot of different issues. In particular, one woman, my husband came back from the war broken, and now it's my job to fix him. There's a lot of stigma attached with the possibility of mental illness. So she's dealing with, veterans issues as well as stigma. So there's substance abuse. One particular person in a focus group said that we definitely have a severe drug problem in our community, especially with teens. Usage of marijuana, which seems to be accepted and considered an average or normal thing to do in this community, may lead younger generations to attempt to try other drugs in addition if they feel marijuana is okay. So that was a concern. It may not be a scientifically based concern, but it is still a concern. Health disparities, so one example was all-cause mortality rate for men per 100,000, and we saw they sort of stratified it by race, and we're seeing American Indian and Alaska Native at a all-time high. All-cause mortality for women, sorry about that, for women was measured actually in percent, not in rate. But if you see here that the percentages were more similar between white, black, and American Indian, Alaska Native, and lower here, which looks a little different from your male counterparts. So that was that, and then we have infant mortality. You guys have discussed this when watching Unnatural Causes in the first couple weeks of the class. We were looking, when we saw that short film about unnatural causes, we were looking at how the infant mortality rate and low birth weight, which is the next slide, are almost double that of the white population. And that is also true in Tacoma Pierce County. We see the same thing with low birth weight. Again, the percentage is almost double that of in African American and Black infants. It's almost double that of white and American Indian. So, and then this demographic group, it's also, keep in mind that it's hard to judge because many American Indians and Alaska Natives are biracial, and that's due to a very low population from historical factors. So if we think about this, we don't actually have a clear picture on their numbers because many of them are biracial, which is not an option here. So anyway, we'll continue next time. See you for part 2.